As Katya said, I'm Justin Nichols. I'm the founder and CEO of Sift Healthcare. Sift is a data and analytics company that brings intelligence to healthcare payments. We help healthcare providers optimize payment outcomes from both patients and payers by integrating machine learning into their existing revenue cycle workflows. Sift's leadership team is made up of industry veterans. Our head of analytics is the former vice president of insurance claims analytics at LexisNexis. Our CIO is a former platform architect at LexisNexis. Our COO is a former CEO of a company that was ultimately acquired by LexisNexis. Our head of product is the former director of revenue cycle optimization at Nordic Consulting and was also a product owner at Epic. In terms of outside capital, the company's raised about $7 million to date, and we've got about 24 employees. In terms of traction, Sift is currently working with 7 multi-billion-dollar health systems. On the small end, about 1.2 billion. On the largest end, about 6.5 billion. We're focusing on building out our integrations into both Epic and Cerner, and we also have a smaller regional health system on the Allscripts platform. We also have one of the larger outsourced revenue cycle management companies as a client. Our platform has scored over 6 million patients and $10 billion in production. And we were a finalist for the 2019 Accenture Health Tech Challenge, the 2020 Matter Health Tech Challenge. We were a featured startup at the 2020 McKinsey Early Stage Investor Conference. With nearly 30 cents of every dollar being spent in healthcare due to the administrative burden associated with getting paid, and the 30 cents is going towards paying the army of humans that are working hard to collect payment from both insurance companies and patients. The army is getting so big now that there are nearly 7 additional FTEs working in a billing capacity for every 10 physicians. This is really resulting in about $500 billion annually in total wasted expense in the United States on wasted billing related costs. As a result of these drivers, we fundamentally believe that providers have, in essence, become lending organizations. Every day, they are extending credit by providing services that they have little idea if and when they will be paid for from both payers and patients. We believe that providers need to start approaching their data and transactions like many other well-developed industries where data management platforms are widely deployed to not only understand historical transaction data, but also how can that historical data be used to optimize future transactions through machine learning integrations into the existing workflows that their employees work on. Our platform is EHR, clearinghouse, and revenue cycle workflow agnostic. We ingest and normalize all of a provider's payer reimbursement data, patient payment data, billing workflow data, as well as their unstructured coding data into a unified platform. From there, we integrate machine learning optimizations across the revenue cycle to holistically improve payment performance. On the payer side, our machine learning recommendations prioritize which insurance denials get worked based on the likelihood of being able to overturn them. And our data-driven insights are driven upstream in the claims adjudication process to help prevent future claim denials. We feed these denial trends and payment trends and insights upstream in that process to update claim editors and provide actionable intelligence to functional teams like patient access, registration, coding, and payer contracting. Our integrations help pinpoint the root cause of insurance denials and the appropriate intervention and flag likely denials before those claims are even created. In terms of patient payments, Sift's machine learning identifies which patients will need flexible payment options by predicting their likelihood of paying their bill and how much of their bill they will pay. This allows providers to offer payment options as early as scheduling, and this proactive intervention improves patient financial engagement, maximizes revenue, and creates a sticky relationship between both the provider and the patient. Lastly, we collect and organize all of that operational intelligence around revenue cycle work efforts, like how many times claims get reworked or what patient segments are paying. We then disseminate that intelligence to equip providers with a complete understanding of performance and their cost to collect. Beyond machine learning integrations, Sift's enhanced analytics and reporting help providers fully leverage their payment data. We bridge the gap from the CFO's office to the VP of revenue cycle by providing weekly and monthly reporting that gives a portfolio level view of payments data, telling revenue cycle leaders where their money is coming from, what the likelihood is of collecting it, forecasting what the next 30, 60, 90, and 120 days look like, and recommend what actions should be taken to improve performance. We see this as a critical intelligence for management as they explore new reimbursement models like value-based care, and look to remove the billions of dollars of waste associated with getting paid. We're currently looking for more provider partnerships and early adopters. We are also in the early stages of raising our next funding round, which will most likely include participation from a Fortune 100 strategic.
Thank you, Justin. Fantastic presentation. Let's jump into some questions. The revenue cycle space, as you know, is pretty crowded with RPA solutions. So it'd be helpful if you can explain how Sift's machine is different or complementary within the landscape.
Yeah, no, that's a great question. RPA is taking up a lot of oxygen in the room, but really our principal difference is holistically understanding the totality of a provider's data, because really RPA is automating process, good process, bad process. But fundamentally, we think you need to understand the totality of the data with advanced data science to be able to pinpoint what actions can be improved. And then from there, you can start working outwards and start figuring out what do you continue to automate, but what do you also try to stop from even occurring in the first place.
And how do your providers measure the value of the integrations?
Yeah, that's a good thing with our platform. It's very tangible ROI in terms of hard dollars. They're either collecting more money with less cost to collect, reduce days payable outstanding, or we're failing at our job.
That makes it pretty straightforward. So how do your intelligence tools fit with the shift to value-based care and price transparency and where the landscape's headed?
Yeah, definitely. We think right now that in order to holistically be able to engage in conversations regarding new reimbursement models and contracts, providers first need to understand what is my utilization in terms of clinical data and tying that to their payment data. And if you don't holistically understand that, it's very difficult to start measuring what ifs around what contract should I be entering, and am I giving up in terms of fee for service compared to value-based care.
So another question from the chat, from Jane Chang: how does your product uphold and promote health equity and safeguard against potential misuse of your predictive modeling?
Yeah, it's a great question, right? At the end of the day, helping a provider understand who is going to pay their bill and most likely to pay them helps them sooner in the billing process map those patients who don't have an ability to charity pay or third-party financing companies, or simply understand that patient's never going to be able to pay the bill, so stop sinking sunk costs and chasing them. So it's really about identifying those patients who have an ability to pay the bill, but may need some type of more flexible payment plan structure. You really can't get water from a rock here, and having the analytics to understand who can pay and can't pay really helps improve the relationship across the board.
Awesome. Let's see, I think we have time for one more question. How do you think about the more personal side of revenue cycle management? What does it mean for clinicians and patients to have these financial issues handled more efficiently in terms of their well-being? That's a good question.
Yeah, no, it is a good question. And I'll touch on it in terms of coding, right? Interestingly enough, if you put two coders next to each other, they agree on the codes about 60% of the time in terms of reimbursement. So being able to holistically understand how do these codes relate to likelihood of reimbursement and give further financial guidance as you are looking at coding trends is going to be critical to remove the waste and variability in terms of reimbursement and upcoding and things of that nature.